There's several different types of medical malpractice claims that can be brought in the DC, Maryland, and Virginia area. One of the ones that's not so often thought about is lack of informed consent. What this means is, as a patient, you have the right to know all of the material knowledge in order to make decisions about your care. What does that mean? You have the right to know what sort of procedure is going to be performed, why that procedure would be performed, what it is that your diagnosis requires, and then what the risks are of having that procedure performed. Now, that doesn't mean every possible risk has to be mentioned. However, they do have to tell you all material risks and information. Not only that, they also have to tell you, the healthcare providers, whether or not there are any less risky alternatives that are available to you. A lot of people don't think of this, and there are often several claims that can be brought under lack of informed consent. Now, this is true even if you may have signed a consent waiver. When you go in to have procedures done, people often sign consent waivers, and they think that because simply that they've signed this consent waiver, that that means that they've waived consent to bring a claim. That is not necessarily true, and that's why working with an attorney to review the conditions and the terms of that consent waiver is so important, because oftentimes there are things that are left out of that consent form, and you still may have a viable claim.
It's 1957. You're upset. You're sitting in your doctor's office and he just finished telling you that you have arterial sclerosis and that your arteries are hardening. It's very careful to emphasize that you're at a high risk for a heart attack or stroke. He suggests that you undergo a procedure to evaluate the severity of your condition or to find out just how close to death you are. It's not complicated, just an x-ray under anesthesia, but you also need to be injected with a chemical to enhance the images that are taken. You can't help but picture being injected with something that's going to make your arteries glow neon yellow. But overcoming your hesitance, you agree to the procedure since your doctor thinks it's important. A week or so later, you wake up in a hospital bed and look around a sparse white room. You take a deep breath, move your head around, stretch your arms overhead. But something's just not right. You can't feel anything from the waist down. You try to wiggle your toes, nothing. You try to wiggle your legs, nothing. You try to wiggle a different appendage, but nothing will move. How did this happen? It was a safe procedure, wasn't it? If your doctor knew you could be paralyzed, he would have mentioned it, right? But he must have known. He's the doctor. So why didn't he warn you? It's not right, and not what you were told could happen. So you take the doctor to court. This is what happened to Martin Salgo, and his case became the first to address how much a patient ought to know about any medical procedure or intervention they were consenting to. At the end of the trial, the judge announced that the doctor had severely failed Mr. Salgo. It was impossible for him to make a good decision when he hadn't been told all the information that was relevant to it. The doctor should have stated the risk of paralysis, especially since Mr. Salgo's decision to go through with the procedure is understandably based on the belief that it didn't have any significant risks attached. According to the judge, the doctor violated Mr. Salgo's rights as a patient and failed at fulfilling his duty as a physician. It's because Mr. Salgo brought this case to court that a new legal precedent was set in clinical medicine, one in which a physician has a duty not to just get consent, but to make sure that it's based on an appropriate level of knowledge and understanding. The judge referred to this new dimension of clinical practice as informed consent, and it was the first time the term was used publicly.
The surgeon asked me to share her story of blaming difficult patients for lack of informed consent. When I was a surgery resident, I saw a severely ill, hospitalized man who needed a leg amputation, and our attending surgeon and senior surgery residents never adequately explained to him why he needed surgery. Each morning on rounds, they kept asking him if he was ready for a leg amputation. Our patient would cry and say he didn't want his leg chopped off. He didn't know why it was necessary. The surgery team treated him with disgust, labeled him as a difficult patient, and just walked out of the room. I think it's extremely dangerous when doctors label patients as difficult or crazy. Everyone was calling him crazy. He wasn't no known to have psych issues. They said there's no point in even talking to him because he's completely unreasonable. It's a very normal emotion to be scared about an amputation. Calling him difficult and bipolar stopped our team from conversing with him. Finally, he asked me if I could explain why he needed surgery. I promised him I would. I talked to our attending surgeon and told him our patient was open to life-saving surgery, simply that he didn't know what the surgery entailed and that he was refusing because he was scared. I asked if the attending surgeon would talk to him and he said no. He said if I wanted to, I could. Then he also reprimanded me for staying in the hospital too long and being an inefficient doctor. At 9 p.m., after I was finally done with my tasks, I sat with our patient and brought a copy of his angiogram so I could explain why he needed surgery. It was inappropriate for me as the junior resident to be the one telling him, but I did my best. He was so thankful I spent time explaining his condition. When he understood the pros and cons and risks of surgery, he decided to proceed with amputation the next morning. He could have died from gangrene otherwise. I told my seniors about our conversation. I was never thanked for my work. They just kept calling him bipolar for supposedly changing his mind. Why do doctors act this way? With no labor law protection and no mental health care and punishment if we seek help, some surgeons working 100-hour weeks just go numb from the suffering. Cut off from our own emotions, doctors make fun of patients who still have emotions as sensitive or crazy, and ridicule peers who spend time with them as inefficient. Dehumanizing others is our defense mechanism to avoid feeling our own pain.
Shalom, shalom, my people. Thank you for tuning in to the Black and Healthy Restoring Black America channel here on YouTube and also broadcasting on my Country Living in the City page on Facebook. I am your host, Jawanda Smith, REN Case Manager and Community Advocate. Well, I hope you enjoyed the few clips that I showed you on informed consent. I just wanted to talk a little bit about that, and I have some things to share with you. Um, Informed consent is basically, in layman's terms, making sure that the patient knows everything, even the adverse effects of any procedure or new medications that are being prescribed by a doctor. Um, Also, the clinician is supposed to also make sure that you understand the information that you are receiving. Unfortunately, with some of our minorities that have come into the country who may not know English very well, there should always be interpretation services available to be able to explain these procedures. Because unfortunately, what happens is people sign consents for procedures or medications and then something goes wrong and then they don't know what happened. They weren't informed of these things or they didn't understand them when they were given. So as clinicians, we do need to make sure that our patients know what is happening to them, especially when it's a surgical procedure or there's some diagnostic testing that may have uh, adverse effects, especially when you're using things like um, iodine and dyes in that go through the bloodstream, just for x-rays. So I wanted to show you guys, share some information with you guys regarding this and how you can stay informed. All right, guys, I have a research study here um, from the National Library of Medicine and the National Institute of Health. This is HHS Public Access, and it's a research study about improving informed consent with minority participants, results from researcher and community surveys. And it says strengthening the informed consent process is one avenue for improving recruitment of minorities into research. The study examines the process from two different perspectives, that of the researchers and that of African American and Latino community members. Through the use of two separate surveys, we compared strategies used by researchers with the preferences and attitudes of the community members during the informed consent process. Our data suggests that researchers can improve the informed consent process by incorporating methods preferred by the community members, along with methods shown in the literature for increasing comprehension. With this approach, the informed consent process may increase both participants' comprehension of the material and overall satisfaction, fostering greater trust in research and openness to future research opportunities. So this it goes on to explain the surveys, and basically, I have this point highlighted. Certain cultural and contextual factors magnify the challenge of informed decision making for individuals from racial and ethnic minority populations, including both lack of trust arising from past legacy of mistreatment or misinformation about informed consent process and inadequate comprehension of the information after the informed consent document is signed. Also, I wanted to show you guys this website was sent to me by Dr. Fatima Larry, a sister of mine that I study the Bible with, and she has a website here that also helps you with informed consent. This website is Understand Your Medication. It's basically a website that you can find articles and updates about different pharmaceutical drugs. Um, Also, you can fill out a form about your drug and ask questions regarding um, the drug, so they can tell you how to safely not only take the medication, but it also gives you the side effects and things to do if there is an adverse reaction. Also, it explains some of the services. Hold on, I'm trying to change the page. Okay, some of the services. It talks about uh, they put the drug information in easy to read terminology. No scientific terminology. You know, some of the drugs can have these extremely long names and everything, and people may not understand that. Um, if you want to know, truly know about the risk of death, suicide, and cancer from your medications, understand the bad things that can happen to you from your medications. And they have common diseases and common medication reports. Um, they have things on diabetes, heart disease, high cholesterol, cancer, and high blood pressure, and including COVID-19. And there's, let me see if I can bring up the form. Yeah, this is the form that you would fill out and answer the questions, and you would submit it on the website, and they will give you the report. I think there's a cost for the report, but this website is very helpful in keeping you informed. Well, guys, that's all I have for you today. I will post the links to the Is Your Medication Safe website. Thank you, Sister Larry. And I also will post the link to the research study and the other clips that I put up. Well, until next time, take care of yourself and each other. Until next time, shalom.